All done?
Sorry po. No, affectable eyes. Ay, nako. 1:30. Tagal. Napunta kong Jewel. Sasakalin niya si Jewel. Hindi niya napunta.
Pero kung ano,
O finish muna. Finish muna. Finish your banana. This one, no, banana. Enough already.
Oh.
Elna, maybe you can have IT record this. Lala, kala ko kasi you just command na record and then it records.
Okay. Then what I'm doing is I'm recording it on my YouTube account as unlisted and private.
Okay, then it's okay. All right, so we have already, it's already 1:13. Let's just wait till 1:15. We have 19 people. And then at 1:15 we can start kasi busy si Doktora. We'll just give them additional 1 minute for latecomers. One more. Sila Junela ba nandito?
Yeah.
Any of the ICU girls here? Yan, sila Let from the dialysis. Anyway, maybe we can send the recording if they're probably busy.
Ano, wala akong signal. Wala kasi ako nung
Okay.
Tere.
Except for everybody who is not speaker, please put your microphones on mute. Okay, good afternoon, everybody. Welcome to our nurses education meeting. We will try to have more of these chats, town hall chat style to educate the nurses. This afternoon, we are very lucky that we have a infectious specialist, Dr. Almero, to speak to us. And her topic this afternoon is about PPEs. Not as much the donning, but the value of PPEs. So, Doktora, the floor is yours. I think si Doktora ay nawala.
Nawala siya. We'll wait for her to get in the meeting.
Anyway, we are here and this is going to be the first of the kumbaga nurses education series natin. Pinaplano kasi hindi na tayo pwede mag face-to-face meetings. So ito ay maganda kahit kayo nasa bahay. Kung wala naman kayong ginagawa sa station ay pwede rin. Pero like technical ko minsan may glitches, kaya habang iniintay natin si Doktora, bibigyan tayo ng isang awit ni Doktora Dala.
More? No, okay. Enough na.
Pinakapita. Ganyan
Wala,
talaga.
wala. Prepared ngayon. Okay. Okay, she's coming in the meeting room now.
Nakabutal.
Kaya nag-flicker kanina kasi nawala siya sa meeting room.
Hello.
Hi, Bing!
Sorry po, nawawala nga kayo, no?
Iko-co-host na kita ha ulit.
Marunong talaga sa akin na kayo ng 8:24.
Water muna. Water first, enough C2.
Hello po.
Already. Water first.
Hello everyone. I'm Dr. Bing Almero, no? I am infectious disease specialist po na I am very privileged to have been asked to share my knowledge and also to teach you on how to really value the value of a PPE. I know marami po sa ating mga healthcare workers are still they're very still are afraid or they're still confused on how to deal with the new disease, no, the coronavirus. But I want you to know na it all matters to discipline and also self-care. So ito pong sakit na to, I know it's really rampant at talaga pong nag-cause ng pandemic. But there are ways to really prevent it from spreading and also protecting yourselves from having the disease, especially when you're in the hospital. There are proper ways and protocols on how to put yourself in proper protective equipment. No, I was able to make a few slides. Sorry for the medyo magulo yung slides, but just we can be informal, and I would like you to just raise your any questions that you want to ask. So I'll just have a short of our slides. No? So I know lahat naman tayo healthcare workers, so you know what.
Sorry, Bing, sadali lang. I'm going to mute everybody except for Dr. Almero, okay?
Okay.
Wait. Okay, Bing, you may unmute yourself.
Okay, naririnig po ako ng everyone. Okay? Sige po. So PPE is defined as specialized clothing or equipment worn by an employee for protection against infectious materials kung sa healthcare workers. But ang PPE has already been used so long ago for other industries to prevent yourselves from injuries, dangers, and also illnesses. So ito lang yung meaning niya. Ang sa atin, ang ating ginagamit na PPE sa healthcare settings, common before yung gloves, of course, to protect our hands, the gowns, the apron to protect our skin from any droplets or any splashes, and the respirators or the mask to protect the mouth, nose, and yung respirators naman is in case aerosolizing or intubated to protect you from airborne infectious agents. The goggles also to protect your eyes and the face shield. So these are just the basic PPE. It's just that, of course, now we also use the hazmat, no, the whole white jumpsuit. It's also for better protection in case matagal kayong exposed to patient, for splashes, and also for any soaking of infectious materials. So, bakit tayo gagamit ng PPE? Yung type ng PPE po, depende sa ating pupuntahang area at depende sa ating sa ating a-attendan na patients, no? So, it depends on, halimbawa, kung yung type ng patients na pupuntahan natin, meron ba siyang aerosolizing, may droplets ba siya, or regular patients lang siya na stable naman sila. Also, dapat yung PPE, no? Pag sinuot natin, fitted to sa atin, no? It would be, ideally, meron tayong tinatawag na mask fitting kung saan, tulad nito, no? Ang ginagamit ko, yung alam ko, fit na fit sa face ko. Meron talagang mask fitting activity, pero medyo, siya, we have to ask for I think, yung mga nagma-mask fitting, doon sa, I think, doon sa, I'm not sure, sa toxicology. We do it, ang nagma-mask fitting sa amin sa BATMS is the toxicology unit. Nag-aano sila ng hood and then they kukuha kayo ng mask kung saan kayo i-fit, na kung saan pag meron silang chemical na spray, pag naamoy nyo siya o nalalasahan, so your mask is not fitted. So, ang ibig sabihin nun, baka pwede yung aerosolizing or yung small particles can still be inhaled. So that's how mask fitting is done. But ideally, mas maganda may mask fitting. We can coordinate with that if there's an available schedule for those trained nurses. But for the meantime, gumamit po kayo ng fitted mask na talaga pong mag-seal ng inyong face at wala pong leaks, no? Okay. So sabi noon, no, pag ikaw po ay frontline healthcare workers, you are 11 times higher risk of testing positive, and those pag mali pa yung PPE mo, you have a 23% higher risk of getting the disease. So, talagang ang PPE po, ang pinaka-importante, the proper use of PPE, ang pinaka-ating protection in order to really be able to do our work and function well. So, kung makikita nyo, no, meron pong risk kung hindi talaga tama ang PPE use. But when you're using PPE, no, in some studies, makikita po talaga na wala pong nagiging infected healthcare workers unless na lang magkaroon talaga, ini-investigate na lang magkaroon ng breach, or usually there's a surveillance or investigation done kung meron pong magkakaroon ng ganong case. So, ang PPE is still something that, is a good barrier para maprotektahan ka from viral, bacterial, and all contaminants na pwedeng pumasok sa iyong skin, mouth, nose, at eyes. So this is the most important thing that serves us kung bakit may PPE. Siyempre, actually nga, ang pinaka-importante po sa lahat ng PPE is still the mask, covering your nose and mouth, and then again, yung eyes mo, in case there would be sprays or kaya mga droplets. But very rarely, mas importante po talaga yung mask nyo because of inhalational materials or kaya po yung pag-i-inhale niyo po ng droplets ng viruses. Okay. So, yung pong NIOSH, yung NIOSH na yung National Institute for Occupational Safety Health, no, Personal Protective Equipment Program, yan po yung nag-a-approve ng mga PPE. So, ang PPE po, pag tinignan nyo, tulad itong suot ko, NIOSH approved po to, no? So, mas maganda po talaga, no? Very durable at saka po, legit po yung PPE nyo din sinusuot, no? Because the PPE, these are, yung paggamit ng PPE is a technical method or process wherein we use the materials that prevent work-related illnesses, injuries, and death. Yun po. Okay, so this is the reason why kailangan po din i-regulate o tingnan yung pong durability at saka po yung pong ng PPE, no? Baka kasi mamaya meron po itong mga damages or things like that could breach your yung pag nyo po sa dun sa the breach of the infection control na pwede pong magkaroon kayo ng exposure dun sa infection. So that's the reason why meron pong program or kaya body of ito po yung nag-evaluate ng lahat po ng mga nagpapasa sila. Meron po silang mga criteria kung ang isang PPE ay pwede pong gamitin po ng isang healthcare worker or pwede po siyang i-produce po sa market. Okay. Sabi po ng Occupational Safety and Health Administration, healthcare workers should use proper PPE when exposed to a patient with even suspected or even lang I think even in the OPD, you should be also very careful, no? You should wear at least your proper mask and your face shield. So dapat po talaga nire-require na ito ng occupational dun sa US, no? Requires all healthcare workers to use proper PPE. So this is the only way to prevent ourselves from being exposed. Kasi this already, kung ito'y N95, what I'm wearing, it protects you already about more than 90% na ma-acquire mo yung infection or kaya maanuhan ka ng virus or ma-inhale mo yung infection ng virus. Okay, yung droplets. Okay, so PPE for healthcare workers and employers consists of gown, gloves, face protection, no? And NIOSH certified, ideally disposable N95 po, no? Even po noon, as I've said, the PPE is already important in every workplace setting because it helps prevent injuries, illnesses, and death. So, as long as we're wearing the PPE, you should be already, dapat secure na po kayo. Alam niyo po na protektado kayo. And you have already, dapat confident na rin kayo na humarap sa patients. Kasi that's the only way we can serve our patients properly. We don't have a choice, but you know, this is our job. So we have to also serve our patients, but the only return is that we have to protect ourselves. And you know, the priority is still to take care of ourselves so we can serve others more. So as I've said, for me po, on my experience, I've been, since the start of the pandemic, no, we have already been serving so many, even the first COVID cases in Batangas. I have already, you know, it's really a testimony. I have already proven that the PPE is the only thing that have protected me all throughout. Even in the first cases that, you know, we have seen in Batangas Medical Center, the first COVID wards we have structured or put up there. We were already there. So siguro, to be honest, I've already 20 plus swabs already done since the first months of this pandemic. As I look back, ang akin lang po talagang pinanghahawakan is I really am very, very strict in PPE and even to the residents. Our IM residents have very rare incidents of having positive, unless they are community acquired. But in terms of the workplace, bihira po sa amin na ma-acquire through a healthcare setting because we are, for me, initially before, very strict po kami sa PPE. So I have seen na talagang the PPE is your only protection when worn properly, no? I know it's very tiring, but we have ways, no, of, you know, really putting it comfortably. And siguro, okay lang naman po na mag-change nito kung talaga pong soak na siya or talagang if you need a breather or to be comfortable for a while. So yun po So according to CDC, and transmissions ay paano? Inhalation of the virus. So that's why you have to, number one is still your mask. Deposition of virus on an exposed mucous membrane. So that's why your eyes, no, you still put your face shield. And touching mucous membranes with soiled hands contaminated with the virus. So that's why, you know, you have your gloves and you don't touch surfaces. And it's very important na you're very cautious and very alert and very aware of your movements and also your So these are the most important ways or the most common ways and where you can get the virus, no? So protecting yourself from these three, no? So it's already if you have a very good habit, no? So maiiwasan niyo po talaga ang magkaroon ng infection. I'd just like to share some studies, no, of healthcare workers, no? Maraming studies na nagawa. Sorry for that, no, but dito sinabi, no, dito sa mga, no, they have 3% to even 38%, no, incidence na nagkaka-infection. Bakit sila nagkakaroon ng infection, no? Number one is still working in a high-risk department, but suboptimal hand washing, hindi naguhugas ng ayos. Longer work hours were also observed, but the most common is also the most improper use of PPE. But in a study in a healthcare personnel exposed to patients na talagang lahat sila ay nagsuot ng face mask and even respirators, wala daw nakitang infection dun sa healthcare workers na yon. So, sinasabi dito, no, the use of gloves, eye protection, hand washing was seen as evidence to imply a dose-response relationship. And the association was most consistent, those for wearing masks, no? Hindi talaga sila nagkakaroon. So in other studies talaga, nagpakita na generally everyone used masks, even the others used respirators, walang infection that occurred. So I guess that also applies doon sa inyo, sa ating isolation sa St. Patrick's. I would like to commend the nurses there kasi they're very strict also in wearing the PPE. They wear it completely. And until now, as I think, walang induced in a healthcare setting. It's more siguro kung meron man, it's more community. Lagi yang sa outside, sa family, or sa mga kung saan po exposed. But within the hospital, I am very sure wala po nagkakaroon sa kanila because if you see the nurses in isolation, talagang they're one of the nurses that I've seen who really wears the PPE sa whole shift nila, and I would like to commend them even uncomfortable sila, and they're nagagawa po nila properly yung kanila pong mga jobs as really taking care of the patients. So if you see, wala po sa kanilang nagkakasakit ever since, and I always remind them it's just the importance of that PPE and just importance of just wearing the complete PPE. So ito po pag level 4. But there are places also that you may not wear this type of PPE because this is very uncomfortable na. So overall, I would like to share yung PPE requirements. Pag level 1, we have green zone areas. So sa green zone areas, you can wear your face shield, your properly fitted K95 or a double surgical mask. As I've said, yung a surgical mask na isa, hindi siya sapat. Lalo ngayon sa Delta variant or sa Delta virus, your surgical mask only protects you 30%, So kung i-double mo siya, the better. The better pa nga if you use a K95 with a surgical mask on top. So mas better a K95 which is fitted, and then you add on your face shield. This is for green zone areas lang, But if you see, we still have to use the PPE because there are lots of people doing transactions in green zone areas. If you're in a level 2 PPE, it's a yellow zone. You use your bunny suit. So ito yung mga siguro sa second floor, sa mga negative COVID areas, properly fitted K95 or an N95, a face shield, and a dedicated closed duty shoes. So this is the recommended attire or PPE that you should wear in the yellow zone. Okay, so in level 3 PPE, wherein with patients, you have to wear all these. Kasama po pati yung bunny suit, K95 or N95, your face shield or goggles, your gloves, your washable isolation gown, your cap, and then your shoes. So the outer gown must be worn and changed after contact with the patient. Use sterile gloves only when performing aseptic procedures. Use particulate respirator mask in handling patients with aerosolizing activities, yung intubated or kaya those pwedeng maging COVID-19 suspects. Okay. The level 4 PPE is already used in the main COVID ward. So this is what they use, They have the full hazmat, the shoe cover, N95, the bouffant cap, isolation gown, gloves, face shield, goggles, and the shoes. So still again, the outer gown must be worn and changed every after contact with the patient and use sterile gloves only. So this is for the red zone na. Red zone. So I'd just like to know, these are green zone areas, the OPD room, the record section. This is for the other institution. Ito po ay sa SPHMC government, So these are the example of the green zone areas. So dito po yung mga more of the offices, Dito yung mga offices. Again, the green zone areas, the offices, The laundry, even the procurement offices. And then we go to the yellow areas. Ang yellow areas po is more of the OPD clinics, the animal bite, the triage area, the CT scan, radiology, and all those, the non-COVID ICUs and non-COVID wards, the chemotherapy area, the non-COVID hemodialysis units, the newborn screening, the heart station. So these are the yellow areas wherein may designated silang ano. And the red areas are all operating room theaters, OB, emergency room and unit tents, the laboratories, and even the COVID wards and the COVID modular facility. The hemodialysis unit for COVID-19, the morgue, the laundry area, the wastewater treatment, swabbing stations, and molecular laboratory. So yan po yung aming mga ano. The high-risk activities, procedures such as ET, endotracheal intubation, all the procedures, tracheostomy, gastroenterologic endoscopy, suctioning, nebulization, and also doing the RT-PCR test for the laboratory. Handling respiratory specimen for microbiologic studies, handling of used linen and other items of probable and confirmed 19 patients, imaging examination of COVID-19 patients. So, these are just my slides, no? So as I've said, you just have to know the basics of these, no? So you can really perform well or function well in terms of really when you're on duty. So I'm sorry, Doctor, if there are any questions or for any anything that they would want me to, you know, to explain, or if they have questions, I'm very free to guide or you know, answer questions.
Is there anybody who wants to ask a question? You can ask it now, or you can write it in the chat at ako ang magbabasa kung nahihiya kayo. Doktora, so yung PPE naman ho natin sa St. Patrick, safe na ho siya na isuot na hindi na ho dapat magkaroon ng fear ba yung mga staff na may exposed pa sila sa infection?
Doctor, your set of PPE is complete and it is according to the you know, to the checklist I have showed. Your PPE in St. Pat is complete, also with the N95 actually.
Oh, that's good to hear.
I have no problem with it po. It's actually one of the most complete po that I have ano. Pag pupunta po ako dyan, halos hindi na po ako nagdadala. In others, kasi in others we have to bring some of our own but there po it's complete in terms of the checklist. It's all there. No problem po ako doon.
That's very nice to hear po.
Yes po.
Maganda po yung linagay po nyo yung sa offices dahil sa totoo lang po yung outbreak po namin ngayon ay nasa office at wala ho sa mga wala sa nursing care, doon sila lahat sa business office nagkaroon. So maganda po at
I guess one of the things na hindi ko lang maano dito because it's not related to PPE, I would like to recommend po na yung pong eating in offices is prohibited. Eating together.
Yeah. Yes
Opo.
po.
Or you
And then
can
they should
designate
deal
an
with-
open area. Opo, you
Oh.
can designate an open area or maybe they can go outside muna to eat if they want to, batch by batch.
Opo. Dahil ho yan, noted po, and we'll have Mara try to come up, work with the department heads for a schedule nila for eating.
Madali lang naman po yun. You don't take too long naman. Hindi naman siguro kakain ng 1 hour. So,
Yung miss session po yata kasi ng eating, pati po ako'y guilty noon.
ang akin po kasi, we have to be very careful nowadays. Konting tiis lang po sa akin. Kung mas, nakakatiis po ang mga, yung mismong nurses, no, ay yung nasa nursing, I guess the one in the staff can also share their own contribution on helping this to prevent na hindi magkaroon din ng cases, no. Ang hirap po kasi pag sa workplace, naapektuhan po lahat. Pag may isa po, ang dami na pong maka-quarantine involved. So ang hirap din po, so we have to be very careful also.
Elna, you have any question?
One also that I would like to is yung kung kanilang voluntary honesty ng kanilang symptoms. Kasi marami po siguro hindi po nag-aano ng symptoms. I would like to say tell everyone na I am very kahit po ako tawagan nyo, okay lang. Meron po akong natutuwa ako, may isa pong staff na nag-message sa akin. Wala akong problema sa akin kahit anong oras i-message nyo ako. If you have questions about your halimbawa, worried na kayo sa symptoms nyo, I can already advise and guide you kung kailangan mo pang pumasok or what. It's just the most important thing is early detection. The more that na mas maaga nyo yan i-report, the more na mas marami tayong masisave or mas marami tayong mape-prevent. Kasi kung wala namang problema, atin namang bibigyan lang kayo ng guidance, mahirap lang kasi baka mamaya mas marami po kayo ma-expose, mas marami pong makukonsumong problems and resources. Wala akong problema sa akin. Natutuwa po ako doon kay sir na nag-message sa akin. Kasi sa ganyan, mas less din ang problema namin, mas less din ang possibility magkaroon ng complications kasi natitreat din namin early. Nabigyan ko na po siya ng reseta and everything. So, I guess it's the early detection, early intervention is the key to prevent this thing, no? As I've seen already, it's still the early intervention stopping this thing.
Doktora, ano po ang advice ninyo? Halimbawa on a Monday, nagkaroon po ng sore throat, walang panglasa. Kailan po ang suggest po ninyo na siya po ay matest? Is it on that day or may number of days ba po na dapat antayin bago siya magpa-test from the onset?
Kung active na po ang symptoms, lalo na kung inuubo, yun po we can already test the patient. Pero kung starting for symptoms, I wait at least 2 to 3 days, no, on the 3rd day, para po talaga mas maganda po yung yung makuhang yung value po ng results natin, para po mas mas valid yung results natin kasi baka initially po mas early mag-false but I would already require them to quarantine. Ngayon kung magpa-test sila is negative, just continue the quarantine and then siguro once asymptomatic na sila, completing the quarantine, it's just already safe to say na okay na rin po sila mag-work ulit.
Ay yung pong mga co-workers po nila, sila po ay dapat bang matest? At kung kailangan pong matest, ay ilang araw po ang pagitan bago sila?
Di ba meron po tayo sa IPC, sa infection control na risk assessment. So usually if there's a low risk, moderate risk, and high risk, so yung pong mga direct, kinakategorize po yun ng ating IPCC nurse kung siya po ay talagang directly exposed. Yung pong first degree na directly exposed, mare-require sila mag-quarantine and then have themselves tested in at least 5 days. Pero po yung mga naman po na very low risk na, naka-mask naman, nakasama, they can already be just, they can just self-monitor, doctor, and then just put on the proper protective gears in the green zone areas. And then until kung may symptoms lang, which is very rare naman po, doctor, kung talagang sila low risk. It's always moderate to high risk and really removing the mask and also siguro mali yung mask. But pag we always categorize and do the risk assessment. So if it's just directly like kasama niyang kumain, lagi niyang kasama, katabi niya, kinakausap niya lagi. Actually, doctor, it's also my experience. Ayun nga, I have the driver, ang lapit-lapit namin, but wearing this every day also saved me from from having so it's really important talaga na naka-mask sila. So as I've experienced just wearing the mask, even I'm already close encounter, I have close encounters with real positive patients or positive kasama sa bahay. I have proven talaga na talagang it saves you from being infected. So but that's already moderate risk. That's the reason why I stay put and nagpa-test pa rin ako. But kung tutusin, doctor, kung low risk ka and you're really you just have to monitor yourself and symptom based lang. Siguro yung talagang kasama lang.
Is there any other questions, Elna, or any other nurses there? Would you have any questions to ask? Si Deb, is there any questions?
Doktora, tanong ko lang po yung halimbawa po ay tapos na nag-positive, tapos na ng 14 days quarantine, basta wala na pong symptoms, okay na pong mag-back to work.
Opo, yan po naman ay aming pinapayagan. Pero depende rin po sa area. Kung surgical po, medyo po siguro i-evaluate namin yung CT values. Pero kung sa regular lang po ng mga offices at hindi naman po talaga nagdi-directly invasive handling of patients, okay lang po. Basta po na siya, nakapag 14 days na po siyang recovery.
Opo. Thank you po.
Bibigyan ho namin ng clearance.
Doktora, question po. Halimbawa po, kayo ay co-workers. Ano po, yung co-worker ninyo nag-positive. Pagkatapos po, after 5 days, nagpa-test din po yung mga co-workers. At negative naman po ang lumabas. Sila ba po ay kailangan pa nung 14 days na quarantine or pwede na ba ho silang back to work?
Actually, Doc, ang ano po yun, pwede siguro kahit 7 to 10 days, Doc, pwede na po yun. Sa akin po, 7 to 10 days man lang. Huwag lang naman on the 5th day. So they can po, kung talagang kahit 7 to the 10th day, yun po, pwede na po sila sa akin. Kasi po sila working siya sa, working po, healthcare worker sila So they can resume.
Doktora, clarify, yung sinabi mong 7 to 10 days, were you talking about the swab or going back to work?
After po 7 days and they're asymptomatic, I think they can be cleared to go back to work.
Clear na po. Clear.
Lalo kung sila naman po ay very low risk, hindi naman talaga na-expose ng Pero kung halimbawa po talagang medyo moderate risk, then we extend to 10 days man lang. Kasi if it's 14, ideally 14 days kung sa po ng quarantine. But when we're working in a healthcare, in an institution like this, na po ang ating we can just, economize the things, no? So, yun lang. But we have to be very vigilant lang po in monitoring ourselves po in our activities. So, as I've said, alam niyo po yan sa sarili niyo, no? You have to be responsible. Ang ating pong work ay sa hospital at pangangalaga po ng mga pasyente. So, we have to be healthy for them and we have to be careful for them. It's quite a huge sacrifice. Also, isipin nyo kami mga doctors. For myself, talagang we have to, kasi kung isipin nyo po, kung hindi po ako makalabas or kami mga doctors makapag-attend, ang hirap po. Marami po ang magkakasakit ng tuloy-tuluyan, marami po ang mamamatay, no? So it's our responsibility on how we can end this, fight this pandemic. Kasi the more patients that we can treat, the more patients that we can, have them recovered, then the less the death rates will be, the less the death rates of this country. So yun po lang ang goal natin. And until there's a cure, yun lang. So we will,
Doktora, may mga issues ho kami. For example, meron ho kasi kaming empleyado na nag-positive. Tapos po, yung kanila hong spouse kasama sa bahay ay nag-refuse magpa-swab. Ngayon, on the around the 13th day or 14th day, the patient, the staff is okay. But now, the spouse started to have signs and symptoms. And then the spouse has a swab and it's positive. So how will we deal with the employee? Will we have the employee again go on another 14 days of quarantine, or we can separate them and the employee can go back to work?
Sorry, Doc, yung husband, matagal na may symptoms.
Yung employee,
14 days na.
may symptoms, nagpa-test. Yung husband niya, nag-refuse magpa-test noong na-test itong employee. And then what happened po, halimbawa, the 14th day, okay na si employee, yung husband, who is not the employee, pero kasama sa bahay, started having signs and symptoms, had himself tested, and is positive. So, yung aming bahong employee na magaling na at that point, does she need to be quarantined for another 14 days or hiwalay na lang and then she can go back to work?
Doctor, I guess, na-reswab na yung employee, negative na siya.
Na-reswab na po yung employee at negative po.
I think ano naman po yun, dahil pag negative po yun, mataas na talaga CT values noon, they're already protective of any reinfection at the moment. So siguro, baka incubating na rin yung husband from the start with her. So we can check the CT values of the husband. Kung mataas po yun, he has already been on the disease for quite a while. But kung negative po yung employee, no, and walang symptoms, I guess we can just do the survey. I mean, self-monitoring and surveillance po. She just has to put on the protective gears.
And then she can go back to work.
Yeah po, kasi negative na po siya eh. So I'm just I think magiging protective din naman yung antibodies na meron siya ngayon eh. And if she's vaccinated then the more po naman siguro. Eh di wala tayong choice. Just make her wear the proper PPE on whatever zone she is in.
Na-mention po nyo yung vaccination. So ina-advise po ninyo magpa-vaccination. Kasi po, nung Lunes po, naka-receive ako ng mga report na may mga families of employees, not employees, but families of the employees that refuse to have the second injection of Astra. Ito ba ho, ano ho ang comment ninyo para marinig din po ng iba at masabi rin po nila sa kanilang mga family?
Kung sila nag-refuse.
Hindi ko nga po alam, hindi lang no-show po nag-no-show na lang.
Kasi ganito po, no, unless po nagkaroon ng adverse reaction dun sa una, yun lang po ang pwede pong siguro hindi magano ng second dose, lalo na kung talaga pong pangit yung reaction, like baka po nag-allergy or talagang nagkaroon po ng severe reactions, no? But if they didn't have any reaction o minor lang, hindi ko alam kung bakit ayaw nila magpabakuna. Yun na lang po yun na lang magsasave sa kanila para hindi po sila lumala at ma-hospital. At alam niyo po yun, ang hirap po magkasakit. So kung sana tinake nila yung opportunity, paano kung mawala na ng bakuna? Okay. So I'm encouraging everyone to require their families because yan po ay pribilehiyo nyo. Ang dami pa hong tao sa Pilipinas ang hindi makapagbabakuna. Ang dami ko hong kamag-anak at kakilalang namimili ng bakuna. Ang inyo ay Astra. It's a privilege and an opportunity po. Fortunate kayo. Ang iba kong kapamilya nagsa-Sinovac kasi yun lang po available sa community and they take it. So as I've said, kung minor lang po, wala pa naman yata po sa hospital yung full reaction po. Wala pa naman nag-severe reaction. I didn't hear of anyone from the ER na nagkaroon ng severe reaction. So I guess everybody's okay. It's your choice na lang talaga kung yung first nyo was really severe. But
sa alam ko po yung yata nagkaroon ng severe reaction. Pero ako'y nabakunahan na ng Pfizer ng follow-up.
Ayun po. So, mahalaga po, conscious kayo to get any other vaccine kung talaga pong kayo. Basta you chase for the vaccine.
Kaya naging issue po, 44 po nung Monday ang dapat bigyan na relatives.
Kung alam ko lang, marami po akong kilalang gusto magpabakuna.
Ay bukas na po mag-expire. Kaya nga ang panawagan na po ay yung mga wala pang vaccine kahit para lang hindi masayang yung mga Astra ay magpa-vaccinate na kahit na first dose. Dahil
naman. Sayang
So,
ho, ang dami ko hong ano na naghihiling ho sa akin. Sa totoo lang ho, ang daming nahingi ho sa akin ng bakuna. Kaya nga, ay, wala. Sabi ko, sa totoo lang ho, ang dami ko hong kamag-anak, kakilala, nang hihinging bakuna, even to make them, mag-ano na ng comorbid sa kanila, ginagawa ko, because, wala na tayong choice. This is the only way. This is only saving way to, So, I don't know kung bakit po kayo ay ayaw i-take ang opportunity. Kung meron po kayong adverse reaction, meron po tayong committee, on adverse effects. Yan po ay nandyan din sa ER, yan po ay may forms. Kung talaga pong valid ang adverse effects nyo, kami po ay member din na Region 4 Adverse Effects Committee. Kami po ay nagdi-discuss every 2 weeks. So inaalam po namin kung talagang directly related sa bakuna o hindi. So yan po ay kung meron talaga kayong problema, dapat noon pa sinabi nyo na kung bakit ayaw nyo magpangalawa.
Opo, sayang po opportunity. Anybody else who wants to ask a question kay Doktora? Anybody else? Can everybody? Okay, so any questions from anybody? Let us take this opportunity to ask our questions. Ano po?
For those you can always get my number from the isolation or sa info. Pwede niyo po ako i-message.
Okay. Maganda po. We have 26 attendees.
May
If there
questions po kayo sa PPE? I guess naman everyone is wearing the proper PPE when I see them in the hospital, doctor. Ingat lang talaga. They just have to really
pong security na maniwala sila sa PPE, yun lang po siguro ang kakulangan natin. Yung belief that they are protected.
As I've said, from the start, even when there was no pandemic, humaharap na po ako sa Ebola, MERS-CoV several times, and I only wear the PPE. I've been quarantined several times, and I only wore the PPE. So I have proven that this has been already, the only way in terms when you're working in a healthcare setting. Even before pandemic, I have worn it so many times because of sa amin nga dinadala dati yung mga emerging. And they're more difficult. When you see an Ebola case, it's more difficult. When you see a MERS-CoV case, it's different. So as I've said, yun lang po, kung di kami naka-PPE, baka talagang isa na rin kami na nahawa dun sa mga una pa before the pandemic. So what I'm saying is, always, value and, value your PPE. It's the only thing that protects you.
If there's nobody who will ask any more questions, Ian or Elna, Doctora, we'd like to thank you very much for spending the time. Your time is
Thank
very
you din po. I'm sorry for my informal, but
okay lang. So,
my intention is really to, encourage everyone from proper, protective measures, vaccinations, I hope they're all open-minded and aware that, they will really be more of a, mag-cooperate sila sa ating ginagawang ito. It's the
thank
only
you.
way.
Time nga po na yung staff ay kasama sa isang meeting na ganito. Salamat po talaga. Our President, Lala, would you like to say anything? Closing remarks?
Yes, thank you very much, Kuya. Ano ko lang yung stop share screen. Hindi ko lang ma-stop share. Okay. I'd like to thank Bing. Bing, thank you again so much that you've always been so accommodating to all our requests and inquiries.
Okay
And
lang
to
po.
all the nurses, thank you, and for everybody attending this afternoon. Sana wala na masyadong magkaroon ng vaccine hesitancy. Please explain to your family members that vaccine is also important. Not only your PPE, your vaccine, your PPE. When they all work together, it all helps protect all of us. So please explain to your family members. And thank you ulit. I can't thank you enough. Lagi ka nandyan.
As long as,
Thank you very
sabi ko
much.
nga hanggang kaya, doktora, tayo ay always, floating and tayo. I'm happy po your very accommodating also to me na so yun nga lang medyo po pag may napapagod sorry may asthma kasi ako yan sabi ko
I understand.
anyways I'm going back again mamaya magra-rounds na po ako, don't worry. Para po ako lipad agad pag so
Oo. And I know you've been busy, hindi lang hospitals, but you're also doing home care for patients who cannot be admitted yet. Dr. Almero is doing home care on the patients.
Opo, meron po kami mga home care, na we try to save them already from the house kasi malaking bagay po na ma-treat early sila sa house and then until makapasok sa hospital. And fortunately, yung iba po, gumagaling na rin po doon. So, a lot po is, marami pong nagre-recover. So, it lessens the problems in the community.
So, nurses, if your family member or you know anybody, you can refer to Doktora for home care. So, hindi na sila madadampot sa facility. Tsaka alam nyo naman, kulang din tayo sa room. So, at least sila ay mabibigyan na ng tamang gamot ni Doktora. So again, Doktora, thank you very much. Sana po pagbigyan niyo po kami uli in the future kung meron pa uli kaming mga issues na ganito po. Elna, may gusto ka bang sabihin before we sign off bilang chief nurse?
Hi, Ma'am Elna.
Doktora, in behalf of the nursing service, thank you very much for your time po kahit sobra kayong busy. At hoping po na yung mga nurses na may mga fear pad with regards to the PPE ay mawala na po. Hindi na po sila
If you want, ma'am, pwede po tayo mag-donning and doffing, teaching, yung talagang yung physical, yung mga nahihirapan. Pwede po mag-personal donning or doffing teaching po ako or tayo.
Sige po, Doktor. Co-coordinate lang po namin sa nasa mga isolation area.
Natutuwa po ako sa nurses nyo, lalo na yung nakakasama ko sa isolation. Sila po talaga ay laging very proactive. Napaka po nila. Natutuwa po ako. Sila pa po ang mas nakakatulong sa akin kasi they volunteer the information, lagi po nagre-refer. At wala po silang sa patients, wala po silang kahit pong pili or
Yes,
ma'am.
Wala po. Wala na rin pong psychiatrist. Thank you very much po. Again, all the nurses, thank you for taking the time. We are 28 now.
Hello po sa lahat.
Time your off days that you took the time to listen to our small lecture. Thank you very much, Doktora. Thank you again. Thank you.
Thank you, Doktora. Ingat po maigi
Thank you po,
kayo.
Doktora. Thank you sa time po. Opo.
Ingat po lagi.
Bye-bye po.
Sige.
Okay.
Bye. Thank you, Lala.
Doktora Lala, thank you.
Anytime. Thank you. I'd like to inform everybody that this meeting has been recorded, but it's on the YouTube. It's unlisted, so if you want to view the recordings, you can ask the admin office for the link in order to view the recording. Either President's office or the administrator's office. Thank you very much.
Noted po, Doktora.
Okay.
I can also share, I have YouTubes of donning and doffing, Ma'am Elna, so I can share you yung YouTube, you can show your nurses. May YouTube link din ako for all
Opo, Doktora.
And we can schedule another time and let the staff review it again, those that were not present.
Opo. Thank you po.
Thank you po.
Okay, so I'm
Care.
in 5 seconds. In 5, 4,